Welcome to this explainer. Today, we're diving into a highly visual, fast-paced, 6 to 7 minute clinical whiteboard review of prostate cancer prevention, all based on some incredible insights from metabolic care. Look, we aren't just going to sit here and read off statistics today, right? We're going to actually map out this disease. Our goal? To take that passive anxiety you might be feeling and transform it into active, informed empowerment. Let's get right into it.
Here's our 5-step roadmap for today. 1. The scale of the problem. 2. Assessing your risk factors. 3. Decoding the Gleason score. 4. Lifestyle and diet defenses. And finally, 5. Promising supplements and interventions.
Starting off with Section 1, the scale of the problem, looking at the global impact and epidemic scope.
1.5 million. Think about that for a second. That's the roughly estimated number of new prostate cancer cases globally, just between 2020 and 2022 alone. It's an absolutely massive global health burden. In fact, it's the second most diagnosed cancer in men worldwide. And to bring that a little closer to home for those of us in the US, the incidence rate is incredibly high. We're talking about 120 new cases per 100,000 men every single year.
Now, the stakes become crystal clear when we start looking at survival rates. Check this out. When the disease is caught early and remains localized, the survival rate is a massive 97 to 98% in the US. That's incredible. But if that cancer metastasizes and spreads to distant parts of the body, that survival rate absolutely plummets down to just 38%. So what does this tell us? It means early, localized detection isn't just a nice-to-have, right? It is literally your absolute greatest weapon.
Okay, moving on to Section 2, assessing your risk factors, specifically what you can and cannot control.
To really map out your personal threat level, we need to divide risk into 2 buckets, what you can control and what you can't. Let's look at the non-modifiable baselines first. Age is a massive one here. Your risk rises sharply after you hit 50. In fact, autopsy data shows that about 40% of unscreened men over 60 already have microscopic signs of the disease. Crazy, right? Ancestry also plays a really critical role. Men of African ancestry have the highest incidence and mortality rates. In the US, the mortality rate for black men is about 37 per 100,000 compared to 18 for white men. And finally, we have genetics. If you have a first-degree relative, like your dad or your brother, with prostate cancer, your risk doubles or even triples. And get this, even a family history of breast cancer increases your risk, all because of shared genetic mutations, like BRCA2.
But here's the empowering part, the modifiable factors. This is where you actually have agency. Poor metabolic health, specifically things like obesity and metabolic syndrome, are directly linked to a much higher risk of advanced or lethal prostate cancer. Physical inactivity, that also drives up your risk of developing aggressive forms of the disease. And, it almost goes without saying, but smoking is consistently linked to higher prostate cancer mortality. These are all areas where you can step in and actively intervene.
Which brings us to Section 3, decoding the Gleason score, understanding aggressiveness.
So, if cancer is detected, how do pathologists actually measure the threat level? They use something called the Gleason score. It's basically a simple matrix. Starting at the top, we have grade group 1, which corresponds to a score of 6. This is considered low grade. It means the cancer cells are slow growing and they actually still look a lot like normal glands. But as you move down the chart to a score of 8, you hit the high grade category. These are largely abnormal aggressive cells. And then at the very bottom, you've got grade group 5, which scores a 9 or a 10. This is the absolute highest risk category, completely dominated by abnormal cells that have the highest risk of spreading.
Let's pivot now to Section 4, lifestyle and diet defenses, proactive steps.
All right, so here are your essential proactive steps, things you can do right now. First off, if you are in a high-risk group, you need to begin your PSA, that's prostate-specific antigen, screening early. We're talking around age 40 to 45. Next up, make a real commitment to getting 150 minutes of moderate intensity exercise every single week. It's so crucial for optimizing your immune and metabolic health. As for your diet, you'll want to lean heavily into the Mediterranean diet. So think plenty of fish, vegetables, legumes, whole grains, nuts, and lots of olive oil. And lastly, intermittent fasting. Doing an overnight fast of more than 11 hours might actually modestly reduce your risk by lowering those insulin levels and just improving your overall metabolism.
Now, just as important as what you do is what you don't do, right? You really need to eliminate some specific dietary threats. That means severely limiting, or let's be honest, ideally dropping completely, processed meats. Sorry to all the hot dog fans out there. You also want to cut out ultra-processed foods, high-fat dairy, and excessive calcium.
And, it goes without saying, but you need to avoid smoking and heavy alcohol consumption completely.
And finally, Section 5. Promising supplements and interventions, nutraceuticals, and repurposed drugs. Let's kick this part off with a truly powerful nutraceutical, EGCG. This is the main active compound that you'll find in green tea. And what's super fascinating here is that studies have actually shown EGCG can inhibit cancer cell proliferation. In fact, for men who already have precancerous prostate conditions, it's been shown to significantly lower the risk of that cancer progressing.
Next up on the list is sulforaphane. This is a compound that is heavily concentrated in cruciferous vegetables, particularly things like broccoli sprouts, and the data shows some real promise in reducing tumor severity. But even more impressively, in men dealing with recurrent cancer, it's been shown to actually lengthen the time it takes for their PSA levels to double. It's essentially slowing the progression of the disease right down.
Now, we also need to take a look at some evolving evidence around some really common medications. So statins on their own. They don't meaningfully reduce your overall incidence of getting the disease, but they are linked to a lower risk of advanced disease. However, the science is pointing to this incredibly powerful synergistic effect when you combine statins with metformin. Recent evidence is actually suggesting that this combination might significantly lower both all-cause and prostate cancer mortality in high-risk patients. It's just a perfect example of how repurposing existing everyday drugs is totally pushing the boundaries of cancer prevention. All of this evolving science really highlights the core theme of our whiteboard review today, which is simply this: you are not helpless. So I want to leave you with one final provocative question to think about. What is one modifiable factor that you can change today to protect your metabolic and prostate health? Whether it's carving out 150 minutes for exercise this week, tossing out those processed meats, or just picking up the phone to call your doctor about early screening, the agency is entirely yours. Thank you so much for joining me for this Whiteboard Explainer, and keep learning.